Oh, good. We have some people. Hi, Greta. Can you hear me?
Yep, I can hear you.
Hi.
Hi.
Who else do we have here? Okay, we have one more.
It was Zuza.
Aziza. Can you hear me, Aziza? I'm not sure. I don't see, Aziza, I don't see your microphone. I want to make sure you have your microphone on so we can hear you. There we go. No? Close. There's a phone. I think you might be able to hear us now. Can you hear us?
Yeah, can you hear me?
Oh, great. Hi, how are you?
I'm good, how are you?
Good.
It's just me and you and Greta.
Oh, so far.
Yeah.
Sometimes it takes a few minutes to get everybody together. So maybe
Sure.
give everybody a few more minutes. How are you?
I am great, thank you.
Good.
Yeah, I just wanted to let you know, me and Nathan Fordham here, well, Nathan is not here on this call right now, but we are planning to work with the gambling family. And we haven't done that before. So we have two couples that we are interested in working with as a couple, as two counselors, co-counselors.
Wow, that's great.
Yeah, so I'm here to learn about that. I just wanted to let you know.
Yeah. Have either one of you worked with families at all before?
I've been working with the gamblers primarily, and Nathan has been working with the SOs separately. But we haven't done the couple sessions yet together ever.
Okay. So
Yeah.
while we're talking about that, that's actually the first thing on our list is, oops, how did I do that? What do you think would be most helpful for you today in getting ready for that kind of conversation or that kind of work?
Okay, so, so we have a couple, the wife is the gambler, and the husband is not a gambler, but he is elderly. He has a lot of medical concerns, and he's dying, basically.
Okay.
And they have very different views of what's going on. And the gambler, I work with the gambler. The gambler has the view of how gambling is a symptom of, stress from the marriage. Mm-hmm. And she has to take care of him, and she has a lot of responsibilities. So that's that's a interpersonal dysfunction. And the gambler feels like, the conflict in the marriage is happening from the gambling.
Right.
Right. So we, they are in, but, I think we are going to start doing with, we are going to start with treatment planning.
Mm-hmm.
Right, but I don't know, like, how do we work with the couples who have very different view of what's going on? I guess that would be really helpful.
So what are you thinking so far? And hello, Mary, nice to see you. What are you thinking so far? Do you have any ideas that you want to start with?
No.
That's okay. Yeah.
Yeah, I actually haven't seen this gambler lady for a couple months. She became disengaged when we lost a counselor who was seen then as a couple.
I see.
So I don't really know, if she's still gambling. I don't know how, her mental health stuff is going on.
Yeah.
And she's not really trying to see me individually at this moment, I don't think.
Okay.
But they are interested in seeing the couples.
Yeah. So they both, and I know, we always say that, remind everybody that this is not specific supervision or case advice. in this call, but let's just talk in general about how you might think
Okay.
about this. Mm.
Thank you.
Yeah, so it sounds like what happens with a lot of people is both people agree there's a problem in the relationship,
Right.
right?
Uh-huh.
And one person feels like the problem, the gambling is a result of that problem in the relationship, and the
Mhm.
other one doesn't. The other one says, no, gambling's a problem no matter what.
Mhm.
And it's the gambling that's causing the trouble.
Mhm.
So I think maybe giving space for both of those things to be true,
Uh-huh.
so that when you look at, do you remember the call we did on mapping the gambling, mapping the problem, and we showed how the problem was impacting the relationship?
I don't know if I was in that session.
Okay, that's okay. I'm trying to do this in a short enough spans because this is a big topic, right? How you actually started with people. But
Yeah.
I think you could probably get both people to agree that the relationship needs to change regardless of, right, that there's a problem in the relationship. That would be a common piece. And I forgot to ask you, does one person have more power than the other?
Yeah. Yeah, the husband.
Yeah.
Yeah.
So one of the things we're finding is that it's really important to, over time, work to make sure that the relationships becomes more equal. Because
Right.
that happens with anybody with any problem is that if you're in a one down position where you're experiencing some oppression in your relationship, that's going to be symptoms of any kind, right? It's going to make more problems. So she may be saying something like, this is the only way I have to get away. This is the way it's too stressful. I don't get enough space. I don't know what, but she's probably saying this relationship is hard for me. Part of the reason it may be, I don't know, but I'm guessing part of the reason it might be hard for her is because she may be in a one down position where she's not able to influence him adequately, or he's not able to attune to her and her needs, right? So she may feel like, well, gambling is one of those things I'm not ready to give up because that's one of the ways in which I get some relief from this pressure. And that's whether or not the relationship caused the gambling. That's really hard to say, and it might have, but gambling takes on a life of its own, right? So at least we know that there's things in the relationship that trigger gambling, right? And so both things can be true, that there are problems in the relationship that were occurring before the gambling and have maybe become possibly even worse as the gambling's progressed. But those problems probably pre-existed the gambling, and they're going to be problems that they need to resolve no matter what. Right. And then there's the ways in which the relationship triggers gambling. And those are going to be really tied closely to the problems that they're experiencing. So I think I would really work with them on, obviously, the gambling piece, and but if you can tie the relationship patterns, even the pattern of interaction around the gambling trigger, and how the trigger is part of that pattern, so that they're increasing their awareness about the relational problems and how those contribute to problem gambling, and then in turn how problem gambling contributes to the problems. So they're mutually right. They're both things are true, right? Just the more you gamble, the worse the relationship gets, maybe. But you might be doing that to get some relief from a very difficult relationship, in part. And you're also doing it because you've become, developed a gambling disorder that won't go away just because your relationship gets better, but it certainly would help to have a better relationship. Does that make sense?
Yeah, it does.
Yeah, so I think talking with them about what they agree on, I think they would probably both agree that the relationship needs to be better. They have a different perspective about the connection between gambling and the relationship, but I think everybody agrees it has some connection.
Right.
Saying, wow, this relationship makes it really sort of feeds the gambling because I need to get away from it or whatever. I need something that I'm not getting in the relationship, or that kind of thing.
Okay.
And then they have all the end of life stuff to deal with, which
Yeah.
is another topic, right? But I think maybe seeing what can they get on board together with, and knowing that they're at really different stages of change relative to being ready to stop gambling.
Mhm.
So he says, I want to stop gambling. I want you to stop gambling, but I don't want to change the relationship. I don't want to give up my power or whatever. And she's
Mhm.
like, well, I don't want to give up the gambling. And so you get into kind of a tug of war where you don't give up the gambling until the relationship changes, but you don't change the you know what I'm saying? So kind of work on that too. And then as you're doing that pattern, maybe be thinking about, how do I, in session, actually help them become more equitable? How do I get him to really listen to her and attune to her?
Right.
And so if he doesn't know how to attune to her, then it's going to be really difficult to create a more equitable relationship where they both have influence, and one doesn't feel like they're being having a power under kind of experience, right? I know this is a lot, and I'm happy to talk with you other times too, but and then I think as you're looking at those patterns and you're attending to them in the session. So if he's being demanding, you would need to interrupt that and make sure that she has a voice. If he's not attuning to her, you need to attune to him so that you can begin to get him to turn and attune to her. I know that's kind of advanced, but those are some of the things I would be thinking about. And then there's some practical things you can do right away. Like you can have them begin to do things like have non-gambling, non-problem time together.
Right.
So that you just start looking at what are some of these sort of general ways in which you can work with couples to start decreasing the gambling, or at least do something other than gambling before you're ready to leave the gambling. Do you know what I mean? So non-problem time together, non-gambling time together, other activities can be sort of a practical, easy way to get them to start having some relationship outside of that conflict and outside of that gambling.
Okay.
And if they're really in high conflict, they may not want to do that. So sometimes I'll send people on non-problem dates. You can't take a single problem with you, even if you sit and just look at each other. And you can't go to a movie. You have to look at each other. So, that's an interesting one to do too, just in general, to give you some practical ideas to get started.
Okay.
Thank
you.
Yeah, it's a lot. I mean, it's hard to go that whole distance in helping you figure out how to work with a couple in just a few minutes, but I hope that gives you at least something to start with.
Yeah, it does.
Okay.
Yeah, I appreciate it.
And there will be more stuff coming here for everybody, which is what we're going to be talking about today.
Awesome.
So does anybody else have any particular need for this forum? So it looks like we have David and Greta, and then also we've been joined by Marie. Can you hear us, Marie?
Yes, hi.
Good, hi. And so this is a small group, but let's tell you what Greta and I planned, and then we'll see what you think. So this is the last advanced forum, and so we wanted to talk about kind of ongoing future needs for family training. And I think what we just talked about is sort of getting at that sort of need for ongoing work and training. But so I wanted to give you an update kind of on what we're doing with this multifamily group curriculum. And then Greta's going to talk about kind of where we're going next. After we do that, I have the outline and a partial draft of our draft, sort of about maybe half done, of a manual that I'm working on this year for that has been supported by the state. And so I was going to show you a little bit of that and some of the topics to see if there's any input about the topics. Does that sound okay? Anybody?
Yeah.
Okay. And David, you can unmute yourself. It's fine. There's so few people that it'll be fine to just stay unmuted. Yeah. So fun to watch that little thing. There goes the mute button. Okay.
Hi, Teresa.
Hi. Okay, so I wanted to give everybody an update that maybe 9 months ago or so, a group from one of these advanced forums that we did the topic of multifamily group in problem gambling treatment. And a group of interested parties came together, me and Frankie Di Ferdinando and Brandy Leday and Diane, oh, for Pete's sakes. Diane, sorry, I'm so bad with names. Anyway, we all came together. 2 of them are family therapists, and then Frankie's the director of our problem gambling treatment center at Lewis and Clark. And so we've been working on a curriculum for multifamily group treatment for problem gambling. And we kind of got into it. So we kept going and going, and we're not quite done. We have one more meeting to finish the curriculum. It's going to be about 75 pages of detailed ideas about what facilitators do. So each week, we have 8 weeks. Each week has a pretty detailed facilitator guide. There's handouts and resources and so on all the way through it. So that will be ready shortly, and they've done an amazing job. We are going to test drive it and ask a couple of students at Lewis and Clark to actually pull together a multifamily group, and we're going to work on that, and all of us observe that and see how it goes, and then make final changes. At that point, hopefully by the end of the spring, if we get a multifamily group to come, we should be ready to turn that over to you, Greta and David, for whatever you'd like to, whatever way you'd like to use that. But it'll be a fairly formal package of tools.
It's great. It's exciting.
Yeah. And I think some of the tools you can actually use with individual families as well. So that'll give us a little bit of that. So I want everybody to know that's coming. So the next one is where we're going next in providing professional development support. So Greta, do you want to take the lead here?
Okay. Excuse me. So I think I understand what you're talking about. So I just wanted to kind of cover, so before we went to the decision to design the manual, we had really contemplated several different things. We'd been looking at different things such as different levels of billing codes and billing reimbursement rates based on the level of experience and training a person had around working with families. So what we had first thought of is to develop this very elaborate online type training that people would complete. And well, as we got further into thinking about that, we realized we didn't have the funding, or did we really have the time to create that, what really needed to have happen. So we decided with the funding that we had, we would go with this manual. So the hope is still to move forward with designing a reimbursement rate system based on different qualifications for family work, and hoping to use this manual in some kind of capacity around that. So that's one way we're going to use the manual. It's not all yet figured out, but I think as the manual rolls out, we'll have more discussions with possibly the multifamily therapy group or Teresa to determine how that will look, how that best would look. So, and also with this manual, it's some hope, and like I said, it's really hard to envision all of this right now without actually seeing the finished product and knowing exactly what it looks like. But it is hope that some type of professional development and continuing education credits and stuff like that, some kind of tracking forum can be used with this manual to help move our system forward. So I don't have a lot to say on the professional development, but we know that this manual is going to help support our system in working with families. We just don't know at this time exactly how it's going to, but we want people to know that we are continuing to invest in working in making sure that our providers are more comfortable in working with families. And also we want to invest in trying to figure out at the agency levels of the agencies that we have how to incorporate, if they have family therapists, into our system as consultants, or to use them as our providers, and for them to be also gambling informed. So those are things that we're going to continue to work on. And I think with the development of this manual, it gives us more leverage and credibility to move these models forward with agency administrators, and work with the integration of problem gambling services into the other type of family services that the agencies are already offering. How was that?
Great. Thank you. Anybody have any questions about that for Greta?
I can also talk a little bit about other concepts that are not necessarily fundable at this time, but concepts that we have had, some more so than others. I would say about a year ago, we had a discussion with Teresa and some of her Lewis and Clark colleagues. And we are looking at ways to reduce. So we're looking at ways around, not around the OARs, but we're looking at ways to reduce paperwork that has to be completed by a family member, specifically like those family members that may come into services with us that do not have the gambling individual in services also. So we know that it can be very difficult when a family member comes in for help, that they don't really see themselves as needing treatment, yet we have to do the whole process as assessment and treatment plan, and that can just, and all the paperwork that goes along with not only our program at Herbert and Lewis, but also your agency's requirements. So we're looking at ways to reduce some of that paperwork and still meet all of the administrative rule requirements. And I think we're testing a little of this project a bit at Lewis and Clark, correct, Teresa?
Right.
And so we're hoping that in the future we can provide some training and education around how to maybe work with family members with a integrated chart with those that are also being seen with the gamblers in the facilities, in the agencies. So we're looking at ways to reduce some barriers for those family members seeking help, instead of calling it treatment, just seeking help and advisement from us. Also, we would like, what we do not currently have funding to support, but we would like to develop our own helpline for those that have been impacted by a gambling activity, to have a direct contact to a helpline, which would be the same helpline staff that we currently have, but a specialized phone number for impacted others. And through that number, we would like to set up as kind of a system that would provide some general education, brief education, basically just over the phone, so that if so people wouldn't have to go through the whole process of enrollment, but we'd still be tracking who we're talking to. And for people who really are just looking for a little bit of 1 hour of information to help them get to where they need to go, and then kind of doing a screen of some sort to see if they needed to move on to an actual treatment facility for that additional help. So that's kind of like another thing we were thinking about incorporating into our contract with the helpline. It's on the back burner as a thought, an idea, but we just didn't have the funding the coming biennium to support that. So it's just, those are some other concepts of how we're trying to look at working with family members and impacted others in our systems a little bit, how to look at them differently and how to work with them differently, in hopes that we could bring up those numbers and reach additional people. I know that the Oregon Lottery is very interested in doing some marketing and promotion around trying to bring more family members and impacted others into our system. And that's why we need to spend this time focusing on this, to ensure that our providers are ready to see those clients if they walk through the door, but we also want to look at other models of assistance that we might be able to provide them that's not necessarily the standardized treatment model.
Yeah, are you thinking at all about sending out packets to those families that call in?
Well, what do you mean by like
Well,
packets?
there's the research that shows that when people are given psychoeducation materials
Mm-hmm.
after the first phone call, or with a helping phone call like that, that that in itself improves things. So some places are actually, doing the call, but or maybe they're not doing an hour call, but they're sending out information in the mail or
We could-
a website or something. But I think
Yeah.
it is interesting to see the different places that are doing that and how they're showing some that it's helpful.
So yeah, we could definitely look into that. That doesn't seem to be, I don't know how many, I don't even know if we track it that well, if we know how many family members are impacted, others actually call the helpline
Right.
versus other people, which we could look at. But yeah, I think what we could look at, if that's having an impact in other areas, or we found that through the research, then we can definitely look at doing something like that. We also have the opportunity where, and I don't know, I'd have to look at this manual, but we do have also the Dr. Hodgkins family, I don't know what it exactly is called, but his family manual, which is a version of the, maybe not a version of, but it's like the gear manual that he created, but it's for family members. So it was created as a telephone-like counseling tool.
Perfect.
And I'm not sure, and maybe we could at this time figure out how to use that if possible. Maybe our gear counselor, Diane, would also be open to doing that.
So lots of potential possibilities that are exciting.
Yeah.
Great. Anybody have any comments or questions for Greta?
No.
Okay. So the next part of this, about this treatment manual, I really would love input. And I know there's not a lot of people on the line, but please feel free to offer input, because I think that this is the purpose of this call. So the focus of it. So, we're thinking, okay, we're not going to do these forums in the future, but we're going to do this instead. And I think this will do things like when you were asking about questions about, like, how do I start working with a family? When you're calling in a forum, it can be difficult if you haven't been involved in 2 years of forums. So anybody new that's coming in or starting to work with families, this forum is fairly limited because it takes topic by topic over, 3 months later you get another topic. So the manual is organized so that you can start from the beginning, and it needs to be understandable, readable, accessible, so that you can, when you're starting to work with families, you can go through the whole manual and you can have tools, and you have ideas and concepts that are way too involved to do on a phone call. So the idea is, how do we provide specific family-based ideas and treatment in some form that's really readily accessible for people. And I think in the long run, even though we had started with maybe doing some kind of online format like we did with the supervisor training, clinical and supervisor training, I actually think this is going to work better, because even that online piece, we couldn't have gotten all this information in there. The other problem with, I think over time, it would be great at some point, one of my sort of daydreams is that we would do something more simple than a huge online learning component where you're doing multiple, bringing in multiple people like we did in the last one, and instead just using actors and family therapists to demonstrate some of these skills. So it would be a much more concise online learning piece that could take some of the concepts we're talking about in this manual and help them sort of come to life for people. That's just my thought. There's no talk about it yet. There's no funding for it or anything, but it would be, I think, really helpful to be able to say, okay, here's how you could do X, Y, and Z, and here's what it looks like. So, but for now, we're doing, here's the basis behind it and so on. So I wanted to start by, where am I here? Oh, I talked so long, my thing this got stuck. Oh, there. Okay, so I'm going to show you the manual format, and I know David and Greta, you've already looked at this format of the first chapter, but I'd like to get other people's input as well. And I'm looking for, is this format accessible? Is it easy to use? There's a lot of examples in the draft that will be in the manual, and are they helpful? And then not only how the manual's put together, but I'd actually like to go through the contents, which I now pretty much have developed, and look at what areas am I missing that people would like more input on. So I'm hoping that everybody can be on board to help with that. Does that sound all right?
Mm-hmm.
Okay. So I'm going to show you, this is what's in the manual, but I'm going to show you actually the manual itself so you can get a feel for it. And I'm about 100 pages into the draft, which is what's coming along. I sort of live with it. I sort of stay with it all day and all weekend and sleep with it. So this is the sort of look of it. Let me see, let me get it down to the correct, oops, that's not right. I must want to do 200. There we go. So this is chapter 3. Let's go back to chapter 1. So some of the chapters are more complete than others because I'm just working as I go on different areas. Oh, and one of the things I wanted to mention is, you know, more recently we've been working on motivational interviewing with families. And so that kind of those new ideas that aren't in the literature that we've been working on over the last year or two are also going to be in this manual. So there's going to be some stuff that I think is really helpful that maybe hasn't been developed or shared before in problem gambling treatment with families. So this is just the table of contents, and I'll go through that a little bit in a minute. It's a lot of topics. We're going to include a glossary. I say we as if I'm a royal we. I'm going to include a glossary. So there's a bunch of terms. I think you brought this up, Greta. Just making sure that everybody understands all these terms that 30 years later comes. I mean, they just roll off my tongue because I've been in this field for a long time. But they may be things that people are brand new to a lot of people. So it'll start with a glossary. And that's only part of the glossary. So here's the format, which again, Greta, you and David, you've seen this, but it's going to look something like this. So the language, I'm trying to make the language simple and straightforward. So each person struggling with problem gambling affects approximately 8 to 10 others. This includes parents, children, blah, blah, blah. So I try to just keep it really everyday language. And then I want to show you, so there's a bunch of stuff here about families and gambling. You don't need to go through all the content, but from time to time, I have these boxes so that as the reader is going through this, you're able to move your attention to something a little more interesting than just text. And of course, in a good, well-written manual, you don't have lists within the manual. Typically, you have them set apart. So here, there, for example, is a set of lists that are like highlighted things that you could look quickly at and say, oh, okay, these are some of the things I really need to pay attention to, and then you would still be reading. So I try to go through a lot of the basic stuff about families and support networks and so on. And then I have other text boxes that highlight things like this one highlights an OAR, and it's the definition of family according to one of the OARs. If you are familiar with the OARs, there's more than one definition of family, but I don't go into that kind of depth around exploring the OARs. I just include the one that fits best, that would most apply to our work, for example. Then I have, here's an example of a sort of a display or a framework to talk about examples for first phone calls. So I give situations like a potential client calls saying their marriage or relationship's at risk because their partner discovered gambling debt. And then I say, well, this might happen. The caller will likely be motivated to bring in their significant other. On the other hand, somebody else might say, oh, in this situation, you might not want to bring. So how do you differentiate from that first phone call who to bring in, if they're ready to bring somebody in, and so on? So the goal being that we're thinking about bringing family members in, and whenever appropriate, we are encouraging family involvement or concerned other involvement from the very beginning. So I wanted to kind of get down into the kind of how-tos, how to make decisions, how to actually think about or specifically engage people, for example. So I'm going to pause there and see, because I've been talking a lot. Any input so far?
This is great.
Thank you, Azusa.
Yeah, this seems awesome. And I will say that I do have to run in a bit. I got a client who should be coming in at 11:15 or so, but as a sort of newbie to the problem gambling field, all this sounds amazing, and I'm really looking forward to all the changes that are coming and having more guidelines and more resources to draw on to guide my work with folks.
Good, thank you. So we'll know that when you drop out, it's not because all of a sudden we'll know what you're doing. That you're leaving to see.
Yeah.
That's it, I've had it. Enough of this first call examples. Okay, so anyway, I'll just go through quickly here a couple more examples. So I have places here where I've taken an important, what I think is an important sentence or two. We did this in a book we just wrote too, where we just highlight a couple of sentences to break it up for the reader so that you can sort of have some visual diversity there, and you can kind of have something besides just words. I struggle. Then I do have one list here, and then samples, like here's a sample letter of invitation to a family member. Then I do a number of samples in here, include, so we talk about common factors, and all this is also from the literature. So these main ideas are backed up and drawn from literature and family therapy and in problem gambling, so that you've always got it's not just my thoughts. It's some of it is new, and it's really, I'm developing it, like doing motivational interviewing with families, but it's still all based on the research doing multiple motivational interviewing with individuals. So everything's backed up by some other research that's being done or other people that have written about this. So then I give real practical things like this is something, for example, Azusa, when you're seeing your couple, there needs to be something about the informed consent needs to be different because the confidentiality is different. So here's an example of an actual excerpt from the informed consent at Lewis and Clark that addresses, and we use this language to address confidentiality expectations. So whenever there's something like you have to sort of figure out, I'm trying to include an example, not that you have to use it, but at least, you could sort of pull something out and plug it in so that you're not having to create forms and wording for your informed consents and so on.
Yeah, that's cool.
And then we talk about, I talk about the milieu and all this stuff. Here's the poster that everybody likes. I don't know. I think we should decide with this poster. But here's one of the posters that we developed at Lewis and Clark that you could actually take and blow up and put in your own clinic if you wanted to, or in a therapy room. So basic tools like that. I have a checklist from each chapter just to kind of give you a quick overview, and then additional resources. And Greta and I talked about this, and we decided to go ahead and offer links, even though, in a year or two, those links may be broken, but still it's better than not having links. And then the references, this is an incomplete list of references here. I have to complete it, but the references would be, whatever research and literature I've used in the chapter. I just want to show you a couple more things here, just so you get an idea. here's the whole process and tool for screening for domestic violence, for example. So every client couple you see, you should be screening for domestic violence. So it includes sort of best practices and potential ethical problems as you start to work with families that are different from working with individuals. So it includes things like that. And I just want to show you one other example here. Oh, I include here a potential for just an idea for how you might do a family assessment, what might be included, and then I walk through in this chapter on assessment, you know, what that might look like. But you don't have, nobody would have to use this form, but I thought, well, it might be helpful as a starting place to have an actual form. And then I do another one here on the treatment plan. Here's a treatment plan form that David helped immensely with figuring out. I think I've got this the way we agreed, David, right? Does it look right?
Looks good, yeah.
Yeah, okay, so we did this on another call, which was really helpful. So I'm including those kinds of things. Now, some of the content you know, includes some of the things we've talked about in the last 2 years, and some of it is new. So let me go back here. So format, any comments about the format? What else would make it would be good? What else would be helpful?
I like some illustrations or, I don't know, pictures.
Pictures, okay.
I was thinking that also. I do like what you did with putting some of the text in boxes and having the checklist and that kind of thing. I think maybe having some more imagery might help even more to break up the text.
Great idea. Okay, what else? And one thing I didn't talk about is there's going to be a lot of case examples with actual dialogue. So you can see what, you know, when the kind of intervention, what you might say, and then how clients might respond. So there'll be quite a bit of, there'll be quite a few case examples. But picture imagery is great. What else could I do that would help make this more usable?
Is this going to be translated in Spanish or Chinese?
Up to the state. It'll be up to Greta at this point whether that would be possible.
Okay.
What do you think, Greta? I don't know.
Well, if it's requested of us, then we kind of have to do it. That's my standard state response. But I guess it depends on, like, to me, I guess if this is more of a manual for a therapist, then, I mean, it makes it, I don't know. It's a lot of expense to translate. Not only is it a lot of expense, it's a lot of time because then we have to have it reviewed by
Right.
someone who really understands our field, because translators don't really translate things always. I don't know how to say it. It doesn't come across the same way.
Right.
And so it's something we can, so I guess my response is, yes, it's something we can always take under consideration.
Okay.
Maybe what we could think about, I don't know if this would make sense, but anything that we're going to use for handouts for families,
Right.
maybe that's where we start with the translation.
Okay.
Yeah, definitely.
Yeah, so like the poster maybe could be translated, and because the concepts also change, the language changes the meaning too, right? So, and we want the meaning to be culturally situated.
Right.
So we'd want to be thinking bigger than just translation, right? We'd want to be thinking about how do you make it culturally, how do you adapt it to the cultural group that you're targeting?
Yeah. Yeah, I guess I wasn't sure if this was made for the therapist or for the clients, you know?
Mm-hmm.
Yeah, but it's
This
for
is
the
definitely
therapist.
for the therapist.
Okay.
Definitely.
They don't really need to have so many illustrations or pictures.
You don't think we need as many if it's just for the clinician?
Yeah, I thought that was for the clients more.
Well, you know, one of the formats I played with, Greta and David know, I played with formatting for the first like 2 weeks. I was like sort of stuck on formatting. And I thought, oh, you could do those really cool, like they do these sort of quick manuals that have like triangles and they have all these cool graphics in them. And and I thought about that. But then as I'm thinking, it's like going to be 150 pages long. And I thought, I don't know. It just seems like a lot of pizzazz for a family therapy manual. So I was trying to go somewhere between those two and not just make it a boring thing, but include more. But the input's good. More imagery, maybe more graphics, just to break it up a little bit more. So let me play with that idea and see what else I can learn and do.
Okay.
I also think having some handouts, maybe, like I like the idea of the poster, but maybe having specific things, maybe worksheets or something like that for clients to fill out actually as, interventions during therapy and that sort of thing. Like I know that you use that case conceptualization a lot with the family with the child, and both of the fathers are coming from different backgrounds and how power dynamics play into that. So those kinds of things might be helpful just to have on hand to reference as a part of therapy.
Right. Okay.
So
So
there's
for
an idea.
example, I have a map. It might even be that one in this manual. And we talk about how to think about a family.
Thanks, Marlene.
But maybe we could,
Oh, thanks for getting
in
back
that
with
case,
me.
you might give more.
Would you have time to meet with me today?
Is that Marjorie? Is that you?
I don't know why you would.
I'm
It's
gonna
Mary
go
Lane.
ahead.
She didn't mute
Oh,
herself.
I'm gonna go ahead and mute that. Okay. Hold on. What am I thinking here? So some of it might be like a appendix that has a detailed description of how you do something. Like we did that for the multifamily group. We started out with, oh, you're going to sculpt a family. And then, I did that part and the group came back and said, most people don't know how to sculpt a family. You better give directions and specific instructions. So some of it could be instructions to how to facilitate these things. And others like the power and control wheel should be actually made as a handout. So I'd love that idea. And I'm definitely thinking about handouts, but I will concentrate more on handouts, worksheets, things like that are actual tools. So we've been talking about sort of a toolkit that will come at the end, and that's kind of where some of that will come. Okay, any other thoughts before we talk about the topics? Okay, so thank you for bearing with me on this. I know it's kind of specific, but it's so great to get input. So I'm not going to go through every one of these topics because you'll fall asleep, but these are some of the things that I'm looking at as areas of that I'm including in these chapters. So some of it's just why to include people, what to do if you have a family member without the person who's gambling. We have very little in the field about working with children. This will not be a manual specifically in working with children, but it's going to address the need to work with children and some ideas. Let me see where I am here. Who's considered family? So this part about when and how to involve family members is huge. So if we're really trying to get more family members in, we need to understand when to do that and how to do that. So what we've been doing at Lewis and Clark, or what I've been doing, is paying really close attention to when clinicians can get family members in, how they're doing it. And so we're going to put everything we can into this idea, this help for how to involve family members, because what we're seeing, I think, is that many clinicians are not sure when to bring family members in, they're not sure how, and they're not sure what to do when they get there. And that's probably one of the biggest barriers to doing family work with problem gambling is people just aren't prepared for it. And it can be really intimidating if you don't know what to do. So, and then how to connect with everybody. So, that's a big part. And then once you get families, how do you help them? You're develop accurate empathy for people who for family members and people who gamble and so on. But how do you help family members do that with each other? This is still the first chapter.
Yeah.
How to inspire realistic hope. Then there's this whole thing about, we get so many clients where if you were to map the family, the map would show just a complete isolation because they've lost everybody. So I was talking to students about this yesterday, that that's still a family map. It's still a family issue because you have somebody completely isolated. So then part of the goal is how do you open those barriers and start reconnecting clients with estranged others, but also with supportive others that maybe they didn't know before, like peer mentors and so on. But I think too often we just accept that people are estranged and we let it go. So, when, how do you know when it's time, all that kind of stuff. Obviously, we've already talked about confidentiality, limit, and then some of the ethical and legal issues like what are the limits on releasing information and so on. And then I want to talk about the whole milieu. Do you have a milieu where kids can come into the clinic? And what do you do when kids come in and they're young and they don't sit still? And what do you do when they, parents need a few minutes by themselves and so on? Are you set up to handle that? So that's I think most of the first chapter. Then the second chapter on risk assessment and safety planning, I'm really focusing on, because everybody who does this work has to understand suicide risk and potential harm to others and all that kind of stuff, and harm to self. But there's some ways you can work with families that will mitigate risk. So this chapter is really focused on things that are particular to couples and families, like screening for intimate partner violence, but also how do you include a family in the safety plan? How do you get the family to go on suicide watch if they need to? And those kinds of issues.
You might already be getting to this later, but I've also ran up against issues in terms of meeting with support people one-on-one, so they initiate counseling themselves, and then kind of struggling with getting the person who's struggling with the gambling to engage in treatment themselves.
Yeah.
So I don't know if that's spoken to, or
Let's add, I think it is, but I'm going to put it in my notes because that's a huge one, right? If it isn't, then I must have. But anyway, I think it's in this first chapter talking about involving family and important others when we talk about what about when they come in without the person who's gambling. But that is huge, right? And there's a little bit of research, and I know you and I talked about it, Greta, a while ago, looking at CRAFT, which is a behaviorist program for family members without the substance abuse, someone who's abusing substances, for the family to work without that person. And so far, there's only been, I think, one research project on that, looking at how that works with problem gambling. And so far, it hasn't proven, just with the one, it hasn't proven that helpful. So I kind of want to jump on it and use it because it's something. But on the other hand, we need to make sure that it's useful for problem gambling. But nevertheless, whether it's that or something else, definitely we want to be working with people to get the person who's gambling into treatment. So I'll definitely emphasize that. Thank you. Okay. Anything else come up for anybody so far? Okay, so I planned it sort of like why you involve and when you involve people. Then the next thing is sort of looking at risk and doing these early things like confidentiality things and screening for domestic violence and that kind of thing. And then I thought, well, it sort of makes sense, the next one, to go to family assessment and treatment planning. So you'll notice in everything that I work on, I don't use enabling anymore because it doesn't fit with the more strength-based framework. We use protective behaviors instead. But that's what, when you see protective behaviors on this list, it's what we used to call enabling. So we're looking at all these things, what are we assessing? Are we assessing what stages of change they're in, around which issues, relational issues, just like you talked about, Azusa, when you were saying, wow, there's all this conflict. And then at the same time, one person thinks it's the conflict causing the gambling, the other one thinks the gambling is caused by the relationship. And it's that kind of assessment that is required at the beginning when you're looking at sort of what's going on in the family and the patterns and the structure. And I asked you about power, which is looking at family structure. So it's sort of like, how do you think about this family from the very beginning and do an assessment so that you can address what you need to do? And just like you said we're on our way to writing a family treatment plan. And so how do we know which things to consider in that treatment plan? And then what kinds of relational diagnoses might we offer besides individual diagnoses? Anything about treatment plans or assessments that you're seeing missing here or that would be of interest?
Looks good.
Okay. Then I struggle a little bit here with where to put these core concepts. So I started out putting them early on, and it sort of was like, I don't know, sort of like become a family therapist and then go do problem gambling. So now I'm trying to sort of find a place. So where do you get this basic theoretical, not a whole overview of family therapy, that would be way beyond the scope, but you need to understand enough about how family therapists think, the way in which we think about what's going on between people and the relational approach, and looking at processes rather than content, looking at different levels of change. So these are really, really core basic family therapy concepts that typically go across family therapy models. So these are fairly trans-theoretical, not completely, but I tried to pick those that are absolutely necessary and that are also trans-theoretical. So you could just get a sense of like, okay, if I'm working with a family, have I considered the family life cycle? You know, this is a family where somebody's leaving home or is having difficulty leaving home, or this is a family with a new child and they're in that stage, or the example you gave earlier was this is a family at the end of life stage, and what that's going to make a big difference, right? And what happens. And if, for example, end of life stage, are you going to bring the adult children in? So, you typically want to, include, I would think, adult children in, if they have them, when somebody is that ill and they're dying. So we're looking at all that kind of stuff. But mostly this process. So are you watching for what's going on between people and patterns and so on? And that takes some doing to figure out how to do it. But I'm going to do my best here to explain how you might think about that. I think that's all of 4. Anybody have any core concepts that they think would be helpful here? It's hard to know until you read it, isn't it?
Yeah.
Okay, when you can always contact me if you think, oh, I wonder if they're going to include X, Y, or Z. So here I'm really talking about applying family therapy models or model concepts to treatment. So the last chapter was really broad. It was sort of like thinking at a meta level, thinking about process, thinking about family life cycle. And now this is where I jump into making some decisions about which models and which ideas in family therapy are most helpful in problem gambling treatment. There isn't a lot in the literature on working with families in problem gambling treatment. And in fact, there's very, very little. And there's one person who's doing some work with a certain model, developing a model. We, of course, at Lewis and Clark are developing a model, but it's pretty much sort of out. You have to make some decisions here. It's not like I can just go and look at the literature and then report what works or what people are doing. So I did my best here. I'm going to do my best to look at these, not necessarily entire models, but what are the concepts from these models that you can sort of use without getting into a lot of conflicting concepts, but that we found really helpful. So, metaphors of structures, thinking about family schemas, doing a little bit of ideas from narrative, although we don't use narrative therapy. So nobody will become an expert in structural therapy, narrative therapy, cognitive behavioral family therapy by reading this chapter, but hopefully they'll be able to draw from a number of basic, well-used models to address the needs of families in problem gambling treatment. That's the idea. Any thoughts about that? So the decisions I've made here are stay strength-based as much as possible. Keep the problem so that you're not pathologizing the individual, that we can get the whole family on board to fight the problem. Using things like worldview and schemas, because that fits sort of a broader cultural framework, as well as tying nicely into cognitive behavioral therapy, which we use a lot in problem gambling treatment. Looking at structure, because structural family therapy is one of the most simple, direct, easy to apply models, and it's been taught to people who aren't family therapists and used well in the past. So I'm thinking through each of these, thinking how, what's enough to give some map and direction for doing treatment. This is the chapter I've been working on most recently, which is this whole idea of motivational interviewing with families. It's been super challenging and really fun to think through. And I think this will, I think this is going to be really useful, actually. I'm kind of excited about this chapter because it's brand new. Nobody's done this exact thing. And I'm going to give a lot of examples of how to think about doing things you would typically do with individuals, but doing them by questioning different members of the family so that they can point out the discrepancies, for example, and they can together engage in change talk and so on. Do that. Now this chapter, and again, I hope this flows. I would love input on that, but there are certain things you have to do in problem gambling treatment. Just because it's problem gambling treatment. Like, you got to address protective behaviors, you got to reduce the influence of gambling, reduce harm, you got to repair relationships, and there's differences between discovery and recovery goals, for example. I think there's another whole bunch of stuff here. You got to be able to break secrets and get people to disclose. You've got to be able to deal with money. There's just a whole bunch of common tasks that sort of are part and parcel to treatment of gambling in families. So this approaches treatment from that perspective of, okay, if you're going to do these tasks, here's some ways to get those done. That make sense to people?
Yeah.
Mm-hmm.
I know this is really long, but bear with me just a few more minutes. And this one's about structuring the treatment. So this is actually a whole different area. It's got to do with sort of, when do I bring individuals in? When do I bring couples in? Am I doing family therapy if I have one person? Am I doing family therapy? Do I always have to have the whole family? And it's also got to do with what you're doing as you're facilitating treatment. For example, we know inside and out as family therapists, if you sit quietly and try to stay client-centered and allow families to talk and just try to be understanding, that it's bad. It'll just go nowhere. You have to be really active. You have to facilitate. You have to interrupt. You have to know where you're going, structure, and then you need to do in-session and between-session tasks. So there's certain things about how you work with a family that are just really sort of unique to working with a family. And so these are sort of that, like, what do you actually do and how do you get people to talk to each other and all that kind of stuff. What do you do when a couple's in high conflict? I think that's going to be particularly interesting to people. So how do you de-escalate conflict? All those kinds of things.
Mm-hmm.
Good?
Mm-hmm.
And then the final chapter, I think this is the final one, is this comes really from the work that my colleagues and I have done on socioculturally attuned family therapy. So this talks about not just culture, but the interconnection between cultural, societal systems, power, and so on, looking at sort of equity issues. And so, like, again, if we go back to that example you gave us, you said, well, a husband is more powerful than this particular wife, which is very typical because you've got gender and power dynamics at the broader societal level that this family system mimics, right? So we look at it on that broader lens of why that happens and how likely that is to happen. And then how do you get people to start thinking about that and about things like how gender's playing out in their relationships and so on, so that they can develop more equitable relationships. That's it. So any other input? I got the one about the imagery, the handouts, making sure we get how to bring people in when they're supportive others are there, but the person who's gambling is not. Any other input?
I didn't see any anything about the wellness plan.
Oh, good one. Okay. Thank you. That's great input. Anybody else?
I'm thinking from like a more broad perspective, maybe something along the lines of the importance of fostering hope and that sort of thing. I mean, not to say that I don't think people are already doing that in working with clients in general, but it might be helpful just to, I don't know, honorable mention or something like that.
Yeah, that is in there, but I'll highlight it around developing sort of realistic hope. And then it's also in there with the common factors, the hope and expectancy for change. So it's hidden in all that, but we'll make sure to highlight it. But yeah, I think that's hugely important, right? Gosh, I'm getting so many good ideas. Anything else?
Maybe something along the lines of managing, and you might have already mentioned this and maybe I just missed it, but managing the therapeutic alliance in a family or couple setting.
Yeah. Yeah. It is in there, and definitely I'll highlight it because it is significantly different. You've got to maintain alliance with everybody. And the other thing that's in there that will be is it's not just the therapist-client alliance, you're also building within family alliance. So alliance becomes a really important issue, but it goes another step to working on how to get people to be in alliance with each other. Anything else?
Maybe some mentioning about Gamanon or Codependency Anonymous or resources for the family members.
Good idea. We'll do that. Thank you.
Yeah.
Do you think the multiple family group manual should be separate from this, or should we try to package it all together?
If it's separate, we can give it away to the clients, or?
No, it's still a facilitator guide, but you'll have handouts in it. Maybe we'll do it separate. We'll just refer to it in here about where to get it. But it'll be another facilitator guide, so it talks to the therapist. But then each week we have at least 1 to 3 handouts per week that are actual handouts that you can copy and use. So. Okay. Right. Do you think we don't need anything in there about paperwork and state stuff, because that will probably vary as time goes by, right?
Yeah.
that's in development.
In development. Which I
Continuous.
love.
Continuous.
Yeah. That's one of the great things of working with you all, though. Always forward in development. We're getting better and better all the time. Okay, well, that's great. I've got 7 really good suggestions. I'll do one more call here. Is there anything else anybody can think of? If you think of something, please feel free to email me, or actually you can email, obviously, always Greta and David, but you can also just email me directly if you have anything else you want to add. And this will be out no later than June, probably earlier. So pretty soon.
Okay. Yeah.
All right, well, we're a little early, but let's go ahead and end because it looks like the conversation's over. Is that all right with everybody?
Yep.
Okay, thanks, everybody.
Thank you, Teresa. Thanks
Thank
for your
you.
work.
Okay, bye-bye.
Okay, bye.
Don't know how to end.
Neither do I.
Maybe I'm gonna end. Maybe we're gonna, there we go, there it is. And, okay, got it.